Morning, Tri-Cities. It's Friday morning at 9 o'clock. It's time for Coffee with Karl. I'm Karl Dye from Tridec. And today we are going to talk about the current state of the COVID pandemic in our community. So I am very happy to introduce our panel today. We've got a great group of guests to have I think a pretty good coffee conversation and try to talk about the current state of COVID and what's going on and what are some things that we can do as a community to help out. So in no particular order, I'm going to welcome Dr. Amy Person, who's the health officer for Benton Franklin Health District. Good morning, Dr. Person. Thanks for joining us today.
Good morning. I am happy to be here. Uh-oh, sorry, I'm getting some feedback. Do I do my cup now?
Yep. No.
Okay.
Well, I'll introduce everybody and then we'll get to the cups.
Right.
But thanks. It's good to have because you've been on so many times. You know what the routine is.
Not well enough to remember it, unfortunately. Sorry.
We also have our welcoming Dr. Jasdeep Matharu from Lord's Health. He is a pulmonologist and he agreed to join us today. I think he said because he wasn't on shift actually and he was available. But Dr. Matharu, welcome to Coffee with Karl. Thanks for joining us today.
Good morning, Karl. Thanks for having me. I don't know what to expect this morning, but bring it.
All right. It's good to have you on the team this morning. Frequent visitor and guest on Coffee with Karl and our good friend and partner, Lori Manson's the CEO of the Tri-City Regional Chamber of Commerce. Good morning, Lori.
Hi, Karl. It's great to see you. Thanks for having me today.
Well, thanks for your time this morning.
Sure, absolutely.
And last, but by no means least, is John Solheim. He is the CEO of Trios Health, and John's been on before. So good morning, John.
Morning. Thanks for having me.
You bet. Okay, Dr. Person, now it's time for the coffee cup. I'm going to kick us off with, the Starbucks Where You Been mug. They came out with a new Washington one, which I'm encouraged because it's got a few more Eastern Washington or east of the Cascades things. It's got an apple, some wine grapes, a few more things that are more representative of this side of the mountain, which is encouraging because my last one just was pretty west side related. And I brought it this morning to talk about, we are east and west, but we are one state. We're in this together, and COVID's a great example of that. So that's trying to make some point out of a coffee cup that I haven't used yet. And we talked about it before, but I kind of recycle my coffee cup. So hopefully I don't tell the same story more than once. And Dr. Person, how about your mug?
All right. Let's see. Can we see this one? So I've got my not all heroes wear capes. So brought that, to kind of give a shout out to our hospital and physician panelists and also to the business community as well, because you know what? Heroes are showing up all sorts of places.
Amber, this one a power saver.
That's a great point, Dr. Person. Lori, how about you? Do you have a mug you want to share with us this morning?
Sure. I'll let's see. I don't know if you can. Yeah, I think you can see this. Can you? Oh, I've got my thing. It's a woman relaxing, and it says, "I love not camping." So that might tell you a little bit about me. A little into. You won't catch me out camping. So it actually really relaxes me when I see how. She's very relaxed and very happy not to be camping. So
exactly. Well, I think camping makes us appreciate living in a house a lot.
Right.
I know whenever I get back from camping, I'm really excited to lay in my bed and just have some of the things we take for granted. So that's awesome. Dr. Matharu, how about you? Do you have a mug for us this morning or a good story for us? What do you got?
Sorry.
That's okay.
No, I just looked at my mug and realized, no, this is not a fancy mug. This is my place of birth, East Vancouver in Canada, British Columbia. I don't know if you've ever been up there, but if you cross the Cambie Bridge, there's a water tower, and nobody knows the origin of whoever put East Van on that thing. And so it became an icon of Vancouver. So right now, a very beautiful area of Vancouver. It used to be a pretty rough area where I grew up, but otherwise, if you get a chance, go see it.
That's awesome. Is that the logo, or that's what they painted on the water tower?
They did, and it's an unofficial logo. They don't know who owns it. There's hats, there's scarves, it's all over the place. Yeah.
That's awesome. Vancouver's beautiful. I used to travel there a lot on business, and I just read a book by Seth Rogen, who also grew up in Vancouver and shared some Vancouver stories.
Yeah.
Okay, John, what do you got for us for a coffee cup?
Normally I have a plain cup, but you shaved the end. So I scoured my office area and I found this cup that says, "Don't let me use my admin voice." So that's about as deep as I get here. Normally it's a plain cup. So thrilled to be on, and thank you for the opportunity.
Thanks, John. We appreciate you digging up the admin voice cup. Well, we're here today to talk about COVID and the Delta variant's impact on our community. So, Dr. Person, you want to kick us off with just where are we on our statistics and what's the current state of the pandemic in our two counties?
Absolutely. And, unfortunately, a year and a half plus into this, I wish we were looking at different numbers. In Benton County, we're actually seeing case rates higher than we had at any point in the pandemic, even last winter. If I can read my writing, yes, we were at 873 cases per 100,000 over 14 days in Benton County. Franklin County, 898. So they haven't quite hit their peak that they had in the winter, because that was approaching 1,000 cases. But unfortunately, I think we're going to get to that point. Yesterday, we had, for new cases, we had 9% of all the new cases in Washington state, even though we only represent 4% of the population. So, as I'm sure our John or Dr. Matthew can talk about, the impact of that kind of excess cases on the hospitals is really where the biggest concern is.
Yeah.
And
I think, and I read this the other day too, or I read it in the municipal update that you guys gave yesterday, but as we lead the rest of the state in our rate of transmission, can you trace that back in? Like, is it for a reason? Do we have more people that are coming in from other parts of the country or something that are, leading to us on this rate? Like, is there any attribution at this point why we're so much higher than the rest of the state?
That's a little hard to say, although
Okay.
one of the I'm going to say one of the biggest contributors is that our vaccination rates lag quite a bit behind. So it's that combination. We've always been we've tended to always be a little bit higher as far as cases, again,
Yeah.
because we've got industries where people are working close together. We have a lot of beliefs that don't include the use of masks and those kind of things. So that trended us high. And then if you add to that low vaccination rates, we've just got a lot of people for a highly transmissible virus to jump around in, and it is doing that very well.
Yeah. Let's go to Dr. Matthew next. I know John's he's working on his camera, but I think that's really the situation that we're in, that this recurrence with the Delta variant has really had a huge impact on our healthcare community. And there's John. John, if you can hear me, do you want to go first and just talk about how's it going at Trios and within the healthcare community? What, with hospitalization rates as high as they are, how are you guys dealing with it? What's going on? What's it like over there?
Right, thanks. I'm sorry for the computer glitch.
Oh, that's okay.
Phone, so
that's all right.
Just the Murphy's Law. So right now we're about half our beds, a little over half our beds at Southridge are full of COVID patients. So it's really shot way up, and so we're really maintaining that. And shout out again. I always had to start with thanking our staff for all the great work they do there. Not only in the front lines, but they're coming in extra just to help out as much as they can. And that's really taxing us. So we do have some locum staff that are also here to help supplement it, but it's at times overwhelming. We are boarding lots more patients in the ER than we ever have. Again, we're working closely with our EMS partners, and they're doing a good job, but at times the hospitals have had to go on full divert, which means that they can't accept any ambulance, and sometimes modified divert. So we try not to ever go on full divert, because that's the problem. All three of us, all three hospitals are working together not to do that, so we can take care of it. But at times we have half of our ER beds are holding patients because they can't get into a bed here. And frankly, 95, I think it's 97% of all ICU beds in the state now are full. And so it's hard to transfer patients. Nobody wants to do that, but we also have to provide safe care. So it's the surge that, although we had some last year, has really come. And even though we have stood up our incident command, it's more than we've ever really kind of imagined, because you have a bolus at one time of coming in, say a large multi-vehicle wreck that you have several people, but this is sustained now for several weeks. And so, as we look towards the fair, and as we look towards Labor Day, and as we look towards other things, the concern is even more. So again, we think our work with the EMS providers to try to figure that out. The other, although we're very supportive of having everybody get vaccinated, there is some unintended consequences that staff won't do that. And so even losing one nurse, one environmental service, one maintenance worker for their beliefs is problematic. So we are struggling. For instance, I have 32 travelers in, and they can go to other states where it's not mandated. And again, losing those people fill big holes in our schedule because of just the staffing that's associated with that. So, that's all compounding together. Lots of volume, lots of staffing issues. Just people, not so much our employees are getting sick because they're well protected, but just trying to put it all together is taxing our system. So again, thank you to our providers and all the staff in the Tri-Cities that have stepped up to help us. But, frankly, at times it's not enough, and we're doing the best that we can.
You bet. And we appreciate that, and totally echo the shout out to all the providers, the people that, literally this is they're on the front lines of help protecting all of us. But John, has that caused you guys to have to cut back on, elective surgeries and other things? I know you just kind of talked about the emergency care. If there's a car accident or trauma victim or something, maybe it's delayed some of the care, but what about the other side of it? Have you guys had to, just because of the staffing requirements and the facilities, that you've had to cut back some of those services, or how's that going?
We, to be honest, we're monitoring every day. And part of the issue, I think, with our volume, in addition to COVID, is because we cut back on a lot of those elective surgeries before. So it's, all that's coming to roost now, and people need stuff get done. So we haven't done that. There have been days that we adjust for that, but for the most part, we're trying to accommodate everyone. But that is in our surge plan that we would do that. But that just compounds it further down the line, and pushes off things that could pathology that could be cured or fixed rather than delaying it a lot. So we're really trying to be very judicious about that. But if we have to, we'll do that for the broader safety of the community and our employees. But right now it's day to day. Yeah.
No, I appreciate that. I think that's something we'd like to talk about today, and just generally, and realizing, Dr. Person, you talked about it, but people have chosen for their own reasons not to be vaccinated. Now starting Monday, the governor's ordered to wear masks again in an enclosed, when we're inside. And we've all been through this. People are frustrated. They're tired of it. But I think that's a great point, John, that, as the healthcare services become full and become overloaded, then we see these other replications through the healthcare community that people don't think about. It's not just about like, well, I'll be fine, I'll get sick, I'll get better. It's no, actually, if you do have to access the hospital, then it has all this really a trickle down effect. And it's not a trickle down, it's probably more like a tidal wave throughout the health community. I think that's a great point that we wanted to bring out today. Thank you.
Great. Thank you.
You bet. Dr. Matthew, you're a pulmonologist for Lords, and you know, what's it like on the front lines? And yeah, thank you again. Like John said, a shout out to you and everybody else that's in healthcare that's doing your best to keep us safe. But you know, long hours, 18 months in now to it, the burnout, the staffing issues. Can you give us an insight on what's going on or what's it like out there?
Thank you, Karl. It's tough. It is getting tougher and tougher. I'm starting to see the wear and tear on staff. You know, the biggest challenge right now with this spike is air traffic control. Where do we put people? The dreaded question we had in med school, the ethical question, who comes upstairs? Is it grandma or is it junior? And, you know, it is getting close to that. You know, we are full upstairs. As you know, we're critical access. We have about 25 to 30 beds. We have about 12 or 13 on the floor right now. And we probably have 6 in holding. And, you know, how do you get from downstairs to upstairs? And what is the next step if somebody comes in with a heart attack or a mass casualty? We're scared, really scared. And that being said, our CEO, Joni, has been fantastic with helping us navigate through this. You know, our elective surgeries have been stopped essentially, but urgent and emergent is still going on. You know, if you have to stay overnight in the hospital, likely you won't be coming to get your surgery. We have borrowed some OR staff who are critical care nursing staff, and they've come up to the floor now to open up 2 more ICU beds for us. Existing ICU staff, they're already quite burnt out. You know, it's tough. It's getting harder and harder to, how do you say, be empathetic. There's fatigue and apathy coming along with that as well. And then there's the question of vaccine hesitancy, you know, and that's such a complicated topic, from fear to misinformation to just really not understanding what it is all about. It's tough. And I think, Dr. Person, I think you said we're less than 40% vaccination rate in the general Tri-City area. I think that's the last number I saw. It is really reflecting on what's going on inside the hospital.
Yeah. Well, and I think, you know, John talked about it a little bit before, and I think collectively we were having the conversation before the pandemic started, but, you know, in some of your specialty occupations, I think nursing's a big one. We already had a shortage of nurses before the pandemic, and now you compound it with everything you just talked about. It's created this situation that we're in, and it just compounds it because you know, all the things that you said, that makes it that much bigger of a problem. Yeah.
The hard part is to realize not all nursing is the same. We have floor nurses who are excellent, who can usually see a higher ratio of patients, but then when you go to an ICU, stretching them beyond 2 to 1, where they're attached to a ventilator, multiple dialysis lines, etc., it takes a lot of resources. And if you miss out on one nurse, we close that bed. Even one shift would close down a bed, and it becomes pretty tough. Like I said, I don't know how John and Joni navigate that for us, but somehow we are still functioning, and I'm actually quite happy how well we're functioning. We are still doing the best we can, and we've got good outcomes. Yeah.
Well, I think that's why, you know, and we appreciate everybody on really short notice coming together today. We just want to get that message out to tell people what's going on within our healthcare system, and we'll go to Lori next to talk about the business community. But, you know, I think that's, you know, we thought that we learned it. Maybe we still need to keep on learning it as a community, but this is something that we're in all together. I think it's really the nature of public health, right? We kind of learned it as a country, and it was the start of public health 100 years ago with the 1918 flu pandemic. And, you know, Dr. Person, we've talked about it before, but the awareness of public health's role and then the need for it, really, in normal times, we just didn't know. There just wasn't a lot of awareness. And now you guys are front and center, and all the things that we learned 100 years ago are still true today. I was just reminded of a book I read a while ago called The Great Influenza, and I'd recommend it for anybody that wants to learn about viruses. I learned a lot, and I'm definitely not a doctor, a scientist by any means, but I think that's, you know, a takeaway I had from that book is what we're going through now with the Delta variant, right? Like, the longer that any virus is out in a community, when it passes person to person, every time that it does, it has a chance to mutate and turn into a different variant. And I think that's what we're seeing now with the Delta, that it is more infectious. It has maybe a higher rate of, you know, how quickly it can spread and everything else. And that's the problem is as those mutations continue to come up, there could be possibly other waves. And that's, you know, the unfortunate part about it. We've got two things that we can do. And that's where we started, you know, social distancing, masking up, and, you know, as possible, staying the correct distance from other people with the right precautions. And then, of course, get vaccinated. I mean, that's the message, because it's not just us, it's not just our families, it's the whole community. It's impacting our healthcare community right now. And we need to make sure that we're doing everything we can to stay together and to make it through this. I think that's really the bottom line. Well, Lori, let's go to you next. And we really, again, appreciate you coming on with super short notice, but can you give us some context in the business community and amongst your membership? I know you guys made a really tough decision this week to go to a virtual event instead of a face-to-face, but can you give us a little insight on what's going on in the business community?
Sure, absolutely. I just want to start, you know, I have the opportunity to interact with Dr. Pearson every week, and John as well, and hearing about what's going on in healthcare. But just as I listen to the stories and what you're all dealing with, I just really appreciate what you're all doing, and your staff and your team. So you're really kind of leading us through unprecedented times. So yeah, you know, I think one of the biggest messages I think that you know, I'd like to bring is just, you know, how businesses are suffering in terms of right now with you know, labor and workforce issues. I think that's really the kind of the elephant, you know, in the room. We have you know, for 18 months now, we've had really robust supplemental unemployment insurance benefits. And a lot of people, I read somewhere recently where 25% of, you know, what were low wage workers, where they, you know, received little benefits, those folks are now making as much or more with unemployment insurance. So they've essentially, you know, just left the entire job market. So businesses are really suffering, especially in certain industries where, you know, with these low paying wages. And then of course, you know, there's this new term called the Great Resignation that we're, you know, all learning about. And you know, a lot of people have taken this time to really reevaluate, you know, what they're doing for their job, and they're looking for, they're afraid, they're fearful of being in a job where they interact a lot with others. You know, we're talking about the healthcare workers and you know, the pressure that's on them. So people are kind of taking this time to just reevaluate how and where they want to work. Employees are wanting more flexibility as they come back into the workplace, and they want less interaction with people, and they're concerned about getting sick. And so, you know, right now they're the ones that are really dictating, you know, the labor market. And so businesses are really suffering in terms of, you know, we see where, you know, businesses are shutting down, they're limiting their hours of operation, they are only opening certain parts of their business because they can only staff certain parts of it. So, you know, in addition to what they went through for the first year, now they've got almost this new issue where as they open, they just don't have the employees to work those shifts to you know, maintain hours and to serve their customers. So, you know, that's certainly, I think at this point, probably the biggest concern that business owners are facing.
Yeah, I don't think, you know, the few times that I've eaten out that I've not had, you know, like a server at a restaurant that, and they'll tell you up front, like, I just started, I'm kind of learning, you know, I might be a little bit slower. I think they're all going through it. It's kind of a sign of the times, if you will. And you guys had a really tough conversation, I know, this week, and decided with your annual meeting to go virtual. Can you talk a little bit about that? I mean, I think we totally support it. It's the right move. It's you know, safe for everybody, but I know it was a hard decision for you guys.
Yeah. So next Wednesday, the 25th, we were supposed to have our annual meeting, and you know, our annual meeting is a celebration. We were recognizing businesses that have had a great year. In addition, we had some additional awards for a business, a government entity, and a nonprofit for greater COVID response. These were kind of new awards that we were going to give out. And our executive committee met about a week and a half ago, along with our premier sponsor, and everybody was just starting to get, feeling that, kind of uneasy about where things were going. The next day, the health department called an urgent meeting. I know, Karl, you were on it as well. And, we were all just talking about, that we kind of need to take things into our own hands, that, if we don't do what we can, that, it's likely that the governor will come in and, issue more mandates. And so we decided that we would just contact the health department and ask them for guidance. And, we were prepared. Someone said, what if they say not to do it? We said, well, yeah, they might. And so in 3 days, we had 3 conversations, and it went from, it's okay to have it, just wear a mask, to, well, we're concerned about you having it, to, we kind of prefer that you didn't do this in person, 400 people indoors with food. And, it was a really difficult decision to make. A lot of people are impacted by that, but we really thought of it as an offensive move. Our hope is that by doing what we can, that in the long run, we're actually, not being a cause of spreading this virus, this epidemic, and that, that in the long run, that businesses won't close down, and that, we don't want to be a part of any negativity that comes about in the following weeks or months.
Yeah, no, again, we really support your decision. It's the right one for the health of everybody. And you talked about the governor's, what he may do in the future to try to stop this surge. But Dr. Person, can you talk a little bit about, I think the governor earlier this week had a press conference where I believe on Monday, if we're inside, for everybody, whether you're vaccinated or not, we'll be wearing masks. Can you talk a little bit about that? And then talk about some of the discussions that the health districts had in relation to, large in-person events, and what the direction or the current state of what's the best recommendation for all of our health that you guys have now.
Absolutely. As local health officer, we do like it when we can kind of keep watch and work within our own communities to do things. But the health officers across the state had actually sent a letter to the governor last week, just our level of concern about how quickly Delta was spreading everywhere, and knowing that even people who are vaccinated may have some risk. We did ask that he reimpose that mask mandate at a state level, to kind of give better consistency, because we do need that layer of protection. And honestly, wearing a mask is something that is relatively easy to do. It is a lot easier than some of these hard decisions businesses are having to make, or the chamber is having to make about not having an event. And, I think that really speaks to Delta is different. I mean, this community made it through all of the previous waves, even with really high case counts. We did not see our hospitals overloaded to this point. So this is different, and it's been changing rapidly. So, when I was talking earlier, the heroes, again, aren't just in healthcare. They are the businesses making those hard decisions. I also know, talking about labor force, Visit Tri-Cities made the decision to postpone some of their campaigning around trying to get employees back into the hospitality industry that's been hit really hard, because they know that some of those employees are also the same ones that hospitals and clinics are competing for, as far as some of those less technical jobs. So again, there are lots of people making big sacrifices, and what we really would love to see is many more people making a small sacrifice, so that we aren't seeing others having to really take that step, because it is getting serious. I'm going to say staff, was telling me one of their friends had a double mastectomy. They were discharged that same day. I mean, you know, so this is where
Wow.
things are kind of getting to. If you're not critical, that bed has to be saved for somebody who's critical. In Oregon, they have already moved to the point where they are having to make decisions about what patients can go on ECMO, which is that really very intensive treatment to kind of get the lungs to recover. So they're already making decisions about who or who can't get those kind of therapies. And we don't need to be at that point. There are small steps everybody can take.
Well, I think that's a great point, right? Because when we talk about the infection rate that we have now, or transmission rate versus what it was before we got into Delta, that was always the goal. Like before we had a vaccine, but we really wanted to flatten the curve. That was a slogan that I think kind of expressed what we're going through now. We're seeing the curve maybe getting up to this critical point for healthcare, and that was always the goal. But with Delta, it's so easy to transmit, and then we don't have the things that we had to go through last year to stop the transmission without a vaccine, right? We don't have the businesses that had to be closed at that time. We don't have as much of a mask mandate that's going on, and so I think that's what's created the state that we're in, right? It's even though the recommendation was if you're not vaccinated, please wear a mask in indoor spaces. We know that there wasn't any way to monitor that, and people chose to not wear masks. And I mean, I think that's a good point. Do we know from transmission tracing, Dr. Person, is are there super spreader events, if you want to call it that? You know, when people are not vaccinated and they go and they're not wearing masks and stuff when they're in person together, or is it still? I know before when we talked about it a year ago that more transmissions were maybe going on in people's homes. They were still having gatherings and stuff like that. Do you have any trend in that, or is it just kind of all of the above?
It's all of the above. You know, we struggle with over time, people get less and less interested in talking to the contact tracers as well. But with Delta, you know, unfortunately, everybody can be a super spreader, and that's the big difference. Before, most of the time, even people who had COVID weren't likely to spread it. You know, so when we talked about super spreaders, it was really that there seemed to be some people that could spread to a lot. And so if they were in a large event, you saw a huge spread. But now anybody who's not vaccinated can be a super spreader. So we know we had cases that had been linked to, I think, Whiskey Fest. We did see some from the Water Follies, some from Watershed, some from a big wedding out in maybe Idaho or Utah. So lots of those stories. But again, we also see businesses where somebody got sick and now we have to close because, you know, half of or 3/4 of our workforce is sick. So, you know, that's the other labor shortage, right? People that are getting sick.
Yeah, no, exactly. And that's a good point, because I think that's last year before we had Delta, that was the thing, is like if you were outside versus inside, there was kind of maybe a difference in the potential for transmission. But it sounds like with Delta and the examples you just gave, even if you're outside, you can still get sick if somebody has it.
Yeah, I mean, outside's still okay. I think, you know, what's different about some of those big events is outside spread about's one thing. Outside, sitting in the beer garden for 2-3 hours, you know, kind of shoulder to shoulder, talking and laughing, outside yelling at the concert. Again, that's where the risk kind of starts creeping up.
Yeah, because it really is. It's you project, right? It's as you yell or sing or whatever you're going to do in those situations. Yeah, but it helps spread it. Dr. Mathry, let's go back to you. I was going to ask, as a pulmonologist, do you, within your specialty, is treating COVID patients really what you work on for pulmonology, or not so much? Or do you guys kind of wear a lot of different hats in your role?
So on the floor in our ICU, we have a hospitalist and myself, the critical care specialist. I am boarded in critical care medicine as well. And so between the two of us, we run the vents and take care of the ICU patients. That's pretty much straightforward care. What's actually quite complicated is the folks who've already had COVID and, 4 or 5 months ago, maybe some are a year out and they can't breathe. Like I've said before, it's getting tough on both ends, even the recovery side of these things. A lot of folks are on 4 to 6 liters of oxygen. I don't know if you've seen those bottles that only hold maybe about 3 or 4 hours, which limits mobility of somebody. Portable oxygen concentrators are limited for resources as well. The typical symptoms: can't breathe. These are previously healthy people without any comorbid conditions. They can't breathe. Chest pain, they're back and forth into the ER or the urgent care. And really they have lungs that are fibrosed up. Healthy lungs are like a nice wet sponge. You can squish it and just kind of re-expand. Fibrosed lungs are kind of like that, that dish sponge at the end of the munch that has crinkled up.
Right out,
So that's what's there. And then there's the other stuff that I don't really deal with directly is the neurocognitive changes. People with sleep disturbances. I saw a patient the other day. She lost her sense of smell and she wasn't that big to begin with, about 130 pounds. And just because everything smells putrid to her, she's down to about 90 pounds. And I'm trying to figure out what to do with this. And so a lot of that stuff is going on that we really don't hear much about. In both ends, from the ICU end to the post-care end, I'm seeing quite a bit. And this time around, I'm actually seeing a lot more in the clinic. Unfortunately, I have 3 colleagues over there at Cadillac, who are pulmonologists who are seeing about the same. We have got a couple over there at Trios. And then, just as a community, we all are getting along quite well with each other to figure out, hey, who can see this next patient as fast as possible? So we're trying our best to help the Tri-Cities out as much as possible.
And you talked about patients that had been sick before and now they're having the long-term effects, or they've reinfected, like they have an active COVID infection now, or what was that case about?
Sure. Sorry, these are long-term effects.
Okay.
And some I've forwarded it off to University of Washington for transplant evaluation. They're under the age of 65. They don't have any other comorbid conditions, but there's no way for these lungs to recover. And of course, before COVID, it was next to impossible to get a lung transplant. And now that it's here, I don't know who's going to get the next lung, so to speak.
Wow. And so is that patient by patient, but that is essentially one risk? If you do get COVID, you could start to see some of that fibrosis situation in your lungs. Not everybody gets it or has that long-term effect, but there are some people that are affected that way, you're saying?
Right. So some start to have some reversal of what we call transient fibrosis, which is making me really happy. I'll repeat a CAT scan 6 months later and see, all right, some of this area on the lung is starting to look better. And sometimes I'm seeing it actually progress. The progression is what bothers me very much. I mean, I have a different population. I'm just seeing lung patients in my clinic. So I'm going to say, hey, everybody looks terrible. I don't know what the big number is across the state, and I haven't spoken to the interstitial lung disease department at the University of Washington to see what they're seeing there, but they are full as well.
I think that's the thing that we all talk about, and then obviously there's all these discussions going on in the community, but because it's a novel virus, we haven't seen it before, and especially with these different variants that come along with Delta that are getting worse in all the ways that Dr. Person just talked about. And then there's these potentials for long care. It's not like you get the flu and then you get better. Everyone's affected differently, and there's this risk. And I guess as individuals that have this choice that we make, right? Whether it's how we behave, whether we wear a mask or not, whether we get vaccinated or not, why take the risk? And that's what I really struggle with. And it's just interesting, but I appreciate your insight on that. I think that gives us some other reasons I don't want to project this as like everybody gets scared, let's be scared of it, but just to say, what's actually going on, and you know, as adults and as humans and as citizens of the United States and Washington, to understand the risks, right? I think that's, I don't know, do you get any insight in talking to their patients? I mean, we read about like, well, I was really against getting the vaccine, but now I'm, you know, in the ICU with COVID and I wish I would have got it. Do you have any people that you talk to? I mean, I know with HIP and stuff, maybe you can't talk about it, but any stories or insights there?
There's quite a bit going on right now. I foolishly had a town hall in my hospital by myself. I kind of wish I was wearing my hockey helmet at the time. It actually started out pretty smooth, and then it got a little bit difficult, and then it got a little bit belligerent, and then it slowed down. And then I got maybe about 30 or 40 emails after that, people asking about things. I said, you know, my door's open, walk through, and I think that's just it. You need somebody who's, I would say, neutral, give you objective advice, and not cloud it with emotion. And I think after that little conversation in our hospital, we did have some people say, look, I'm going to go get that shot. Now, even in the clinics, I try my best I can. It's a really difficult topic to discuss in clinic. Some will just go off the deep end and call us all sorts of derogatory terms.
Sure.
Others will go ahead and say, you know what, I trust you, doctor. I think I'm just going to go get the shot now. You know, what brings me to that point is almost everybody I've seen in the hospital now, it feels different, and maybe Dr. Person might be able to spread some more light on the data. It feels like this is attacking a lot quicker. It feels like the first time I had COVID patients, I had a little bit more lead time to take care of the patient before they crashed and burned. When I talk about crashed and burned, which means putting them on a ventilator, sedating them, and putting them in an induced coma. Now they just come in, and it's a matter of a few days that it's there. And then the families, a lot of the families, you know, kind of run out and go get the vaccine or do whatever. That's not what I'm trying to tell them to do. I mean, that's just it. But they're seeing how fast they go down. And that's pretty incredible.
Dr. Person, do you have some more insights in that? Do you get sicker faster with Delta? Are you seeing that?
Well, we know Delta, you've got a lot more virus. So, you know, 1,000 times more. You know, I have another theory, and, you know, it hasn't been proven, but I'm also wondering, based on how high our case rates were before and how hard it was to get tested in the beginning, I think we do have a lot more people who had COVID before who are getting reinfected. And that makes me wonder if when they're getting reinfected, they are seeing this kind of inflammatory cascade, which is a lot of what makes people get sick very fast. You know, and again, that's something that may or may not be proven over time, but, you know, we are seeing more younger people are getting infected, which is not surprising since they're less well vaccinated, so more susceptible. But that shouldn't necessarily translate into more people being hospitalized, because they should have been healthier. So we're not seeing that. So yeah, there's something different.
Hey, Karl.
Yeah, John.
I just want to, you know, talented physicians like Dr. Mataru and Cadillac and Trios. I mean, hats off. They've adjusted their treatment style. I think Dr. Mataru just alluded to some of that from, you know, 18 months ago to now. Our mortality, although every loss is big, is not as high as it originally was. So they are adjusting every day for, you know, on the fly to help, and it's working. So I just want to, you know, point out that our local clinicians, you know, they have resources through LifePoint or Cadillac through Providence, you know, University of Washington, we're linked with, we get lots of help. But I just, you know, these providers in difficult times, even though we're full, they are saving lives every day by adjusting by patient. And, you know, I think that goes unnoticed, because I know we all talk about volume, but, you know, the mortality is the thing that really, what we see is the big issue for families and others. So I just want to make sure we recognize that in 18 months, the science has evolved tremendously, and those providers are staying up with it, and we're very proud of the work that they're doing.
That's a great point, John. I think that's a question that we had come in from Facebook related to that, and that is, what are we seeing? I think Dr. Person, you just talked about it a little bit, but with local children in the Delta variant, we've got school coming up, and obviously we have a mask mandate within schools. But are we seeing any difference with Delta versus where we were a year ago on younger patients? And I think, John, you bring up a great point. I think a lot of the folks that actually died from COVID the first go around were older people in the community, or people who were, had some immunity system challenges. And so, maybe that's having an effect, that it's not the same kind of demographic out there. But what about kids, and especially with school coming back on and mask mandates? Dr. Person, can you talk a little bit about younger people in our community?
Well, we're definitely seeing more cases. I'd probably leave it to people treating them to see whether or not that's translating into more hospitalizations. I think not so much. I still think kids are still pretty resilient when it comes to the immediate complications from it. Whether we're going to see more the long-term side effects, not clear. But compared to the end of last school year, at least in our elementary school kids, probably about 4 times as many cases now. So we know the stuff we had in place in the schools worked very well last year to keep schools able to continue. The changes this year, so that even if they're seated 3 feet apart, if they're wearing masks, they don't need to quarantine if they're a close contact and have no symptoms. Those kind of changes will make school less disrupted if we have cases. So as long as people got the masks on, I think we're going to be okay with schools.
You bet. How about, I think they're working on it, but approval for vaccines for what's the age limit now? Is it down to 12, that you have to be older than 12 to get the vaccine? Do you have an update on that, Dr. Person, for when will we have a vaccine for younger children?
That will likely be a little later than they originally projected. The focus right now is really on trying to get more of the people who are at higher risk vaccinated. So that's both the 3rd dose that's been approved for people with moderate to severe immunocompromising conditions. There's the push for FDA to complete the review to give full approval for the Pfizer vaccine. To, again, hopefully remove that concern that people still have, that this is an experimental vaccine, even though, again, it's been given to over 100 million people in the US, and, almost 2 billion people worldwide have been vaccinated. So we aren't going to see any surprises, but again, anything that we can do to help people be more comfortable. But all of that's going to mean that vaccinating the younger kids is likely going to get pushed down a little farther out.
You bet. And I think John, you brought up a great point in the, doctors and the healthcare workers being able to adapt and come up with, whether it's new treatment regimens or new, and I think Dr. Matthew gave a good shout out to like you and your team, and then his CEO at Lords, and I'm sure at Cadlick too, but just being able to balance and juggle the staffing challenges and everything else. But I think this is what it's okay to talk about, right? When coronavirus first came out, it was described as a novel coronavirus. Novel, I think, just basically means new. And I think that I think it's okay to talk about, right? Like there's this expectation in society in general, I think especially with the internet stuff, that we should know everything and everything's figured out. But I think this is a great example of when you get this new virus, we don't know how it's going to mutate. We don't know how it's going to spread. We don't know, every step of the way. And I think compared to 100 years ago with flu, it took them, the flu hit in like 1918, 1919. it took them till 1933 to even know that it was a virus, that it wasn't a bacteria, you know? So, I mean, look at where we are today. Within what, a year-ish, we have a vaccine and it's out there. I mean, you know, science really has advanced to that point, and you guys are doing amazing jobs in healthcare and in science to try to figure this out and keep people healthy. But, you know, we shouldn't as society have this expectation that we just know everything, because it is a new virus and that's the nature of the way viruses work. So I just wanted to bring that up, that it's important within this community dialogue that we have. And when people make decisions about whether it's wearing a mask or virus, we need to recognize that. And we're not going to know everything. We just have to do the best that we can. And maybe it feels bad to wear a mask or whatever, but you know, this isn't that hard a thing to do. We've made it through tougher times. I think about World War II and the Manhattan Project, right? Where a lot of people came to the Tri-Cities to rally together to defeat these global enemies, and we prevailed. It was a lot harder back then that, you know, the community came together. So I just wanted to, I'll get off my soapbox now, but just want to remind everybody, like, hey, we can do this. Let's not break down. Let's do the right thing. Let's help our partners in the healthcare community not be overwhelmed by this. I think I just wanted to make that point before we get back to it. Lori, any thing that all of us, like in the business community, can do or come together? You know, we've come together early on and worked with the health district and the healthcare providers, others to do different efforts. But any ideas about what local businesses can do or what we can do to support everybody out there?
Sure. Yeah. You know, you talk about the hospital CEOs, you know, just diving in and doing things different. And I think that's really what we've learned about business owners and entrepreneurs this past year, is how resilient people are. And, you know, this overused word of pivoting, but, you know, I think that, you know, just overall, you know, business owners are just also dealing with, you know, a lot of unpredictability right now. And they've been doing this for, you know, a year and a half. And you bring up a really good point about, you know, that, you know, we have to pull together as a community. But, you know, we saw this last year where, you know, these business owners are, you know, these are our neighbors. These are parents of our friends, our kids' friends. These are people that support our nonprofits. And when their businesses suffer, then, you know, their ability to help the community also suffers. So, you know, they're dealing with, you know, the fear of more shutdowns. They, you know, we just, you know, less than 2 months ago, we just reopened, and now, you know, continued fear of that. You know, many of them are just fatigued, you know, they're stressed, they've lost employees, they're not taking vacations, they've spent a lot of time trying to find grant money or trying to learn to do things differently. They're dealing with interruptions in their supply chain. I was talking to a restaurant owner the other day, and they were just saying that so many things that they need, they are not being able to, you know, to get. They're either their costs have increased, or just their availability for their products has lessened. So they're, you know, going out themselves into stores trying to, you know, buy these things themselves, and all the while they don't have enough wait staff to, you know, run their restaurant. So you know, I just say, you know, just, you know, continue to support businesses, continue to, you know, go wear your mask, go shop, go eat, but follow these mandates, but support small businesses so that they can, you know, stay afloat during this next wave of whatever it is that you know, that we're going to see. So it's just you know, I don't know that there's any great answer, just that, you know, we just have to really understand the stress and impact that it has on these people. Yeah,
no, that's a great point. And I want to go back to Dr. Matthews, see if you've got any suggestions. And I mean, I don't want to belabor the point, but I think, you know, in relation to other things that we all go through in our lives, and if you have a choice to get sick with an illness, with a virus that we're learning about every day and doing the best thing that we can to keep people healthy. But, you know, there's a lot of unknowns out there. Just think about when people make choices like, you know, this isn't that hard a choice to make when it really comes down to it. And wearing a mask might be uncomfortable, but it's a temporary thing. If we can still stick together, we can get through this. But Dr. Matthew, any other thoughts about that, or any ways we can help encourage, getting people to use healthy behaviors and to get vaccinated if they're not?
Common sense, just common sense. Let's be nice to each other. It's a big deal for just right across the board. We're taught common sense and sincerity in kindergarten. And it seems to be disappearing. I have a lot of friends in the business sector, and their businesses are really hurting. They're tiny businesses. Trying to encourage friends and family. Look, you can go on a national company and hit click, or hey, why don't you just go downtown Kennewick? There's a guy over there. He's got stuff, and just do whatever. Because it's paycheck to paycheck for these folks, and they're drawn out pretty thin. And I want folks to think about those folks, the healthy folks who are getting sick for different reasons because the economy is tanking, because just lack of exchange. These are our neighbors, our friends. This town, I've been here for almost 8 years in the Tri-Cities, really resilient, and they have done very well. I just want to spread out to whoever's out there, support your local business. Please support your local business, whatever it is, whether it's retail, a service, or something. Just get out there, open the phone book. There's things like phone book still, but Google it up and find out what's there. And, help out the guy with a pizza store, help out the pawn shop, help out everybody out there. And that's what I would say. Yes, it is preventable to some degree. We do know how well the vaccines work. Me being a scientist before becoming a physician, I am fascinated with this technology that we have right now and where it's going next. Try to spread the right information instead of the wrong information.
That's a great point. We just actually had a couple of questions. I know we're running out of time, but I'll try to get to them. And this might be for Dr. Person or Dr. Matthew, but have you seen anyone in the hospital with side effects of a COVID vaccination? I know that we all read about that in the media, but and there are some cases of people who do have a side effect of vaccination. Any local examples of that? Have we seen anybody hospitalized because of that?
So I've seen 3 since the vaccine has come out, but not life-threatening. These are pretty typical. A rash that kind of started to crawl down an arm, maybe a small fever. We have had some people who had a strong reaction to the vaccine and had 102, 103 fever. That has been pretty rare, but nobody had to really stay overnight in a hospital. They were usually really taken care of in the ER or the urgent care and made their way out. But I have not seen an anaphylactic reaction to the vaccine here, even though they are heard of.
Okay, thank you. One more brief one, and maybe this is for Dr. Person. Based on the current pace of those who were unvaccinated 30 days ago who are now vaccinated, have we seen an increase in vaccination rate? And do you have any estimate on when we might get to 50%? Are you seeing, because of Delta and because of what's going on, are you seeing the vaccination rate go up?
We are seeing it go up. It's maybe a 0.5 to 1% per week. So, ballpark based on that, another two and a half months for Benton County to get to 50%. Probably another 3.5 months for Franklin County. So that's not fast enough. Yeah, we need to pick up the pace a little more. Yeah,
you bet. Great point. Well, now we're down to 1 minute, but I really appreciate everybody's time. I want to go back around and give everybody a chance to make a closing statement. I think especially with the fair coming up and any advice that we can give to anybody joining us on Zoom or on Facebook today. But John, thanks for your time. Really appreciate your insight. Your point about we've got a really, really good healthcare system here, and we've got these really professional people that are making changes on the fly to keep everybody safe is a great point. But you have some closing remarks, John, or some advice for us?
Yeah, more just I always end by thanking people, because thank the community for the support people are trying to help. Thank the EMS providers. I think they go unnoticed at times. They're always out there, and then thank our providers and staff, all staff, not just doctors and nurses, all staff are important. So really appreciate them stepping up, coming in, really caring about the mission of, the health of the community. So I appreciate that.
You bet. Thanks for your time this morning, John. Lori, how about you? Some closing remarks for us?
Sure. I'll just end where I started, and that's just with expressing my gratitude to everybody in the healthcare, all of the people on the call, and those that aren't, and all of the people that you represent. You've really led our community over the last year and a half, and it looks like we're going to have to continue to dig in. And I really appreciate what Dr. Matheru said. He's probably said it better than I did, but it was just really very, very sincere about just, supporting businesses and, doing what we can to keep our neighbors' business afloat, and just get out there and everybody just do, whatever we can, whether it's to wear your mask or get vaccinated. And I think as a community, we're the Tri-Cities. We can get through this. So, and thanks for the time.
Very well said. Yeah.
It.
Thanks for joining us, Lori.
Sure.
Dr. Matheru, how about you? Some closing words or advice for us? And we really appreciate your time. Thanks for joining us on your day off today.
Thank you, Karl. Just to add to what John said, we really don't realize how much the EMS community does for us. And that includes law enforcement and crisis management. You'd be surprised even on sad outcomes that they've had to see by themselves in people's homes. So I want to shout out to all the law enforcement out there in the Tri-Cities, the EMS crews, fire departments, all of those guys there and ladies. Fantastic job. Thank you. Thank you very much.
Yeah, thanks again for your time. It's great to have you on. Dr. Person, you want to close us out and give us some advice for moving forward?
I think everybody here has really, put it very well. So yeah, just going to add my, thanks to everyone in the community. We see a lot of people, doing the right thing, thinking about what else can be done, coming up with great ideas. So keep those coming in. And as Dr. Matheru said, let's all remember to be kind, no matter, how we think or feel about things and whether or not we agree. If we can all look out for one another. Yeah. And as Lori said, we are going to get through this. We are the Tri-Cities and we will get through this.
It's a great point. And it's a great reason that we're all here together. So, thank you all for your time this morning. I think this is a good discussion. We just wanted to have it and let people know exactly what's going on. And again, have another discussion about, what are some of the things that we need to consider, and they're tough choices to make, but they're really not tough choices when we think about our whole community and what we can do to help each other out, from shopping local to wearing a mask, especially if you're going to go to a large event, get vaccinated. And, it's not easy, but we've been through a lot harder things than this, and we'll make it through together. So thank you all again for your time this morning, and everybody for joining us on Zoom. Have a great weekend. Thank you.
You too.
Thanks. Bye.
Yeah.